Welcome to Ready, Set, Practice, Insights for New PAs, the American Academy of Physician Associates' new podcast designed to help PAs and PA students navigate the early years of their career with expert advice, real-world insights, and practical strategies. I'm Dr. Jennifer Orozco-Kolb, AAPA's Chief Medical Officer, and today we're diving into a critical topic, the future of the PA profession. Our guest today is Duncan Daviau, a dedicated PA leader and advocate who has been at the forefront of legislative efforts to modernize PA practice laws and expand professional opportunities in Massachusetts. We'll explore how policy changes are shaping the profession, what title change means for PAs, and how you can play a role in advocating for our future. Let's get started. Why don't you start a little bit, tell us about you, how you became a PA, and how did you become involved advocating for the profession?
Yeah, so it's great to be here, Jen. Thank you for having me today. Part of the reason I became a PA and part of the reason I became an advocate, it's kind of the same story. I had a family member growing up who suffered from some mental health issues and lacked adequate access to healthcare. So I really fell in love with the PA profession in the sense that it was meant to increase access to healthcare for patients all across the spectrum, whether they have mental health issues or medical issues. The PA profession is there to increase access, and that's what we're here to do.
Yeah, absolutely. And, I come from the inner city of Chicago, where access continues to be a big issue and has been for most of my career. And I think it's so important that we continue to talk about this. And tell me a little bit about what are some of the biggest barriers that we have in PA practice today? And, what does that mean for patient care?
Yeah, so I think one of the biggest factors or issues we have as PAs is we lack the ability to get direct reimbursement in a lot of states. And with that, PAs are not necessarily getting the recognition for the care that we provide and the level of care that we provide. You can imagine if a PA does a bunch of work and all of that billing goes under their supervising doc's name, they're not getting any of that credit. So when stakeholders or policymakers come to the fold to increase access to healthcare or talk about how we can move our healthcare system forward, PAs are frequently left out of the conversation because we're not getting credit for all the things that we do on a daily basis.
Yeah. And you made a comment just a few minutes ago, and I think this is even one of the reasons we're talking about this podcast. And you're from Massachusetts, and maybe you call the physicians that you work with supervising docs, and I call them collaborating docs, and that can be confusing to a lot of new grads, right? And tell me what does that mean? Because you and I both know we've been in advocacy so long. Supervising physicians by legal definition don't actually mean supervising as them watching and critiquing everything that you do. So let's talk a little bit about that, because I think it's important for students and early career PAs to use the right language and to know what does collaboration mean when it comes to practice.
Totally. So I apologize for my misnomer. Sometimes you get just kind of ingrained in saying the same thing over and over again. The appropriate term is collaborating physician. So PAs, we work as part of teams. Nobody does anything in healthcare in a vacuum. And PAs are really that provider who's centered on a team-based care, which I think really makes us unique. One of the great things we did in Massachusetts is during the height of the COVID-19 pandemic is we got Governor Baker to immediately sign an executive order, which temporarily removed that requirement that we had to file a supervising physician with the state. Along that time, there were multiple surgical PAs who work in surgical disciplines and take care of very sick and complicated patients. Many of them were actually going to be on the verge of losing their jobs due to the fact that there was also a moratorium on elective surgeries. All those PAs have very good skills. So by removing that requirement temporarily, we're allowed to have PAs all across Massachusetts join us on the front lines in COVID testing centers, in emergency departments, and vaccination centers when they became available. And what that really did is it really shaped our pandemic response. And there was no reported bad outcomes per the Massachusetts Department of Public Health. And our licensing board has also said that there was no bad outcomes from that care that PAs provided. It really works pretty well for the most part. And I looked to other states like New Hampshire that just recently got their OTP bill passed, which removed that requirement. And they're modernizing healthcare, they're increasing access, and PAs are really part of that conversation. And I think it's great that every single state is working on trying to modernize it just to improve access.
Yeah, Duncan, it's such an important note. And, the work that you're doing in Massachusetts is tremendous. And as you talked through that, I was thinking about our experience here in Illinois, and we had the same thing, right? We had to put orders in place to remove those barriers, because PAs are trained to practice medicine, right? In every specialty and setting. And it's one of the beauties of being a PA that you have that skill set, that training, that experience and expertise to move and flex to your community and your environment. And that was really, really essential during crisis. So why would we only do that in crisis mode or crisis time when we actually have another crisis going on, right? Which is millions and millions of people without access to care and access to high quality care. So tell me a little bit about you have a lot of experience with the Massachusetts Academy. And I hear, especially when you're a new grad and an early career PA, you're like, I don't have time to focus on advocacy, and I don't have time to really, I'm trying to learn how to practice clinically and to do the best for my patients. So tell me, maybe give me an example of what you've done in Massachusetts, and that why it's so important that even a new grad or an early career PA pays attention, knows what's going on, and gets involved.
Yeah. So it's actually kind of one of the craziest things. So I feel like being part of the association for so long, you see a bunch of pre-PA students who want to be involved, and then you see a bunch of PA students. And then like sometime they graduate and then all these people drop off and they just kind of disappear. And as you said, they want to learn clinical medicine. They're not focused on the advocacy issues. But the thing is, within 1 or 2 years, you're eventually going to see that clinical practice issue and that barrier to how you're able to provide care. So my first year is clinical practice. I used to work at a urgent care center in addition to my role in emergency medicine. And so with that, I saw this patient time and time again. He was about 6 or 7 years old the first time I saw him. He suffered from autism. And with that, he was very hypersensory. So he didn't really like patient or providers coming in, looking at his ear, listening to his heart, and listening to his lungs.
Right.
And so with that, I being like a sassy new grad PA, I bet him a Paw Patrol sticker that he could not guess the color of his eardrum. He guessed green. He was right. Of course. So very smart kid. So I got to look at the color, or I got to examine his ear. He got an antibiotic prescription. And over a period of a year, I saw that family time and time again. More frequently, he was brought in by his mom, sometimes the dad. And I never had any concern about the parents. They were very loving and caring and compassionate. Never had any concern. They were doing great for their son who had autism. Then one day, I actually saw the mom come in, and she was in a full-blown manic episode. She was pacing back and forth across the room. She was just talking kind of nonsense, a lot of word salad. And I recognized that she immediately had an acute manic episode, likely from undiagnosed or untreated bipolar disorder. And she likely required inpatient level of care. However, I'm not able to initiate that at our local area urgent care center. I was actually worried that her grandiose flight of ideas was actually going to either lead to harm to her or her son. And in Massachusetts, there's something called Section 12. And what that does is that's a legal status that allows physicians, nurse practitioners, and police officers to sign an order to mandate that a patient goes to an emergency department for a mental health evaluation.
Right.
I, being a PA, I am left off that. And so with that, I had to call a police officer to come give the care. Now, police officers have about a dozen hours in Massachusetts worth of mental health training. I think it's been updated recently, but at the time, about a dozen hours. I have hundreds of hours of mental health training. In every single clinical scenario, I'm dealing with a patient's mental health. Um, so it's really sad that I had to call a police officer. And with that, I never saw that patient again or her young son. And I would stem that directly to getting police involved with their care.
Yeah. Oh my, Duncan, such a great story, and why it's so important that you know what's going on in your state, right? Because that happens in Massachusetts, but maybe that doesn't happen in my state over here. And why are these outdated laws and regulations in place, right? And so as you practice clinically, and you're right, as you go along and start to develop relationships with patients and get more experience in clinical practice as a clinician, you start to realize that you need to pay attention to what's going on around you. You can't know everything, right? I don't have, the law memorized, but you have to know that this is why it's so important to advocate, because my guess is the time period that you had to intervene was so small, and there was really no way to find another clinician at that time to help you other than calling a police officer.
Right.
So good. Thank you for sharing. So let me move a little bit into, okay, you've identified this gap, right? And this issue. We have trouble helping lawmakers really understand, like, why we have to do this, right? Your story was very compelling, and it's a great story. So what do you think are some of the biggest obstacles that we face as a profession when trying to build that lawmaker support for modernizing PA laws, that are really ultimately for the benefit of patients?
Yeah, so I think there's kind of three factors. First and foremost, I think people look at our old title, physician assistant, and they assume we're the doctor's helper. That we're the person who gets the coffee, writes the notes, does this, does that, and does all these tasks. But PAs are licensed medical professionals. We spend 2 to 3 years learning clinical medicine, learning how to assess patients, learning how to implement treatments. PAs go above and beyond every single day. I think about our current president, Thea Nolan, who had a port recall. She was the first person to discover that chemotherapy ports were literally exploding in patients' chests. She talked to her chief, who was a physician. They kind of told her it wasn't an issue. She went to quality. They said, hey, it's probably not an issue. She went to risk management. It's probably not an issue. It's just 1 or 2 ports. She didn't stop until she got to the answer. And then the FDA recalled it, thousands of ports, which saved patients' lives. And that just shows how PAs care. And I think that's emblematic of why we need to modernize our title going forward. I think the second thing is there's not a lot of PAs who are involved in advocacy. There's plenty of nurses who have run for Congress. There's plenty of physicians who have run for Congress. And in state legislatures, similarly, there's about a dozen nurses in Massachusetts that I'm aware of over the last 10 or 15 years that have run. There's plenty of physicians. There has not been a PA in Massachusetts who's ever run for the state house or state senate. So those are kind of the big things.
Yeah. Well, and you brought up a topic that you beat me to the topic, which is really that transition from physician assistant to physician associate. And for those that have been around, I'm considered a dinosaur now, I guess, in the PA world. But physician associate is actually our original name, that began back in the 60s, and then over time somehow got changed. But you brought up such a good point that we have faced, and as someone who's done advocacy for majority of my career, this was a problem and continues to be a problem. And part of the reason we changed the name, not only for lawmakers to understand, but for patients, right? Because of that misnomer of that assistant. And now we are associate, and we have been. We're working through the legislation to change that. But why is it so important that PAs really adopt this name and utilize it in all that they do, for the patient care that they deliver?
Yeah, so I think we really need to adopt the title of associate versus assistant, because associate is more representative of who we are and what we do in our clinical setting. We're not assisting anyone. We're helping our patients, but we're frequently seeing them and assessing them independently. I mean, I work in emergency medicine. I have a very wide scope of practice for the most part. I come up with the patient's treatment plan, I assess them, I see them, I discharge them, I admit them. I'm not assisting anyone in any of those tasks that I do. Um, PAs work pretty autonomously in most clinical settings, and I really think that our name should reflect that.
Yeah, absolutely. It's such an important point, and it takes a long time to do name change. I know the AAPA and others have started to offer guidance, right? So when can I say this? How can I say this? It's okay. You saw we've changed. We're the American Academy of Physician Associates, as well as lots of the other state chapters and others who are free to change. PA programs are free to change. And so we're going to start to see more, and it will become commonplace. But it's something I really want new grads to think about as they enter practice, and why name is so important. So, as we start to kind of wrap up here, what do you think is one piece of advice that you could give to new PAs about the future of the profession?
So I think PAs are going to be used more and more in every single clinical setting, and I think there's no way around it. I think there's outside organizations who may oppose that kind of progress and that change, much to the chagrin of kind of the patients who need care. In Massachusetts, we have something called the Health Policy Commission. Their job is to study healthcare costs in Massachusetts, and also kind of come up with policy solutions. The Massachusetts Health Policy Commission just recognized the tremendous work that PAs do across the Commonwealth, taking care of all of our patients. In that study, they noted that we should remove the outdated barriers, such as having a supervising physician filed with the state, because there's no rationale for it. It makes no sense. It's actually funny, the Department of Public Health actually recently updated our licensing system. And the way that they did that, some people had their supervising physicians from 15 or 20 years ago. We actually had one Brigham PA who told us that their supervising physician had been dead for over 10 years, despite the fact that they had updated it with the state multiple times. So I think it's really important to recognizing the contributions that we have and give to our patients. And I think it's great that the Health Policy Commission has endorsed that kind of thinking. PAs are going to be more and more needed, particularly as we have an aging population, as the baby boomers move into retirement, and we just need more access to healthcare. Ensuring that we're able to practice to the height of our licensure is important to improving access to healthcare.
Yeah. Yeah, I mean, everything that we do in advocacy, right, at the end of the day is, though we're advancing the profession, everything we do is for the patients. And,
Yes.
This isn't because the PA profession deserves this, or, PAs deserve this. I talk about this all the time. Yes, do we? Sure. Okay. We're competent, safe healthcare providers, and we have all this expertise that really, to me, goes untapped. But at the end of the day, everything that we're doing, from name change to modernizing healthcare laws, is all for the good of patients, because it's the patients who suffer. As new grads come out and as early career PAs, it's very hard to want to get involved in advocacy, because they have so much on their plate. Can you maybe give new grads or early career a piece of advice of what could they do, right? I don't have time to go down to Capitol Hill, or, march on my state capitol, or whatever I need to do to make this work. So what can I do to support advocacy efforts of PAs and to be involved?
So advocacy comes in a lot of different forms. You don't need just to come up as a PA in a vacuum with a new law and then run it through Congress and get it signed into law by the governor. Like I said, advocacy takes multiple forms. So it could be something as easy as responding to an action alert from your state PA organization. It could be showing up to a lobby day. In Massachusetts, we get over 200 PA students to show up across the state, which is fantastic. We actually had record-breaking attendance, despite having a Northeastern last year. You can also show up to community events. Frequently, state legislators or local elected officials are at all kinds of community events. I've showed up to a city council swearing in ceremony and met 4 different state legislators. Now, one of them is becoming legislator of the year for Massachusetts because we've developed a great relationship just from that one meeting. You can be an advocate without having to leave your full-time job. Advocacy can take as little as 5 minutes. And I encourage every PA student, every PA, whether you're retired, just starting out, or mid-career, to get involved.
Absolutely. Well, we thank you so much for being on the podcast today. Thank you for all your hard work in the advocacy arena for the profession and for our patients. And I think we're excited what the future may hold. And am looking forward to the next generation of PAs who are going to take over where we are, right? And advocating for patients. So that wraps up this episode of Ready, Set, Practice, Insight for New PAs. A huge thank you to Duncan Daviau for sharing his expertise and insights. The future of the PA profession is in our hands, and each of us has a role to play in shaping it. PAs, don't forget, you can claim your CME for this episode by visiting Learning Central. And if you found today's discussion valuable, be sure to subscribe, leave a review, and share this episode with your fellow PAs. To stay involved, connect with your PA state chapter, support advocacy efforts, and keep the conversation going. Follow us on AAPA's social channels for updates and more insights. Thanks for tuning in, and we'll see you next time on Ready, Set, Practice.